So I didn't get any luck with my doctor, and I started the long process of trying to figure out what was wrong with me. So between going to chiropractors and doctors, and I went to 3 neurosurgeons, and pretty much the same thing. Take your shoes off, walk on the floor, close your eyes. I was fine, you know. I had really nothing wrong when I was standing up. And one doctor did an MRI and didn't find anything. And so I did this for like 2 years. And I progressively got worse to a point where I could not walk without having her alongside me, and I put my hand on her shoulder, and that's how I walked. I went to a surgery group in Tampa. And of course, I live close to Orlando, so that's 2 hours. And they are actually the people that found. They did MRIs. They did a whole half a day MRIs and did different dyes, and they just kept going until they found it. And he said, "Well, the good news is we know what it is, where it is. We cannot operate on the spinal cord where that tumor is. We can't do that. They didn't have a doctor that could do that." So I said, "Well, where can I go?" And he said, "I know there's two doctors at Mayo Jacksonville that could take care of this for you." Dr. Wharen, he looked at me and you know what he said to me? He said, "I'm going to put you in the hospital and we're going to operate on you." He didn't ask me if I could pay for it. He didn't ask me any questions of anything. He just said, "I'm going to take care of it." So now he would like to further his vision, and I'm going to help him.
Well, the Mayo Clinic is extremely blessed to have such grateful patients. And when I heard the Sonnentags were interested in funding the Neurosurgery Residency program, I mean, I felt very blessed because I knew that in the future, medical education was going to be a bigger and bigger challenge as the healthcare issues and funding become tighter and tighter. One of the things that people don't want to pay for is education. Well, there's a tremendous need for training neurosurgeons in this country. There is now a shortage of neurosurgeons, and because of that shortage is actually going to be getting worse because there are more neurosurgeons retiring over the next 10 years than we're able to train.
I know that Dr. Wharen is a great surgeon, and like Dr. Wharen says, he said, now I can create 5, 6, 7, or 8 neurosurgeons, hopefully as good as I am, or better, to go and solve the needs of people out there. And he said there are a lot of people that need that medical support. And he said there aren't enough schools to teach this.
For me, education is one of the very most important things because for me, there's nothing more important than training the next generation. And to have a grateful patient that's willing to give us a gift that will endow a residency program in perpetuity and allow generation after generation of neurosurgeons in the future is just unbelievable.